Coronary artery bypass grafting. It is a surgery that reroutes blood flow past an occluded artery and reestablishes sufficient blood flow to deliver oxygen and nutrients to the heart muscle. There are over 500,000 CABGs a year in the US alone.
Conservative treatments for CABG include changing risk factors. You can do this in two ways: lifestyle changes, such as quitting smoking, changing your diet, exercising, and relieving stress, or through medications that treat high blood pressure, high cholesterol, diabetes, or even obesity.
So if conservative treatment fails, you might need a CABG.
So how is CABG diagnosed? Well, there's several ways. You can do a stress test. You can do an ECG, which is for heart abnormalities. You can also do an echocardiogram, which is a recording of electrical activity of the heart, and a coronary angiography, all right. And that's the most accurate test. And that is a catheter inserted in the leg, and that goes right up to the aorta.
So who might need a CABG? CABG is a surgery that's for people who have severe coronary artery disease, or someone who may have had a recent MI.
Alrighty, so the goal for a CABG is to improve your overall quality of life. How this is done through a CABG is by increasing the blood flow to the heart and increasing the rate at which blood is pumped through that heart. Some other goals are to reduce the later occurrence of a MI and to reduce angina or chest pain.
With CABG, there are also risks. Those risks include wound infection, reactions to anesthesia, fever, pain, or stroke, heart attack, or death.
So, how does the surgery take place? Well, if we're bypassing a coronary artery, we need a graft. So, the historical graft of choice was the saphenous vein, but surgeons also may use the radial artery or the internal mammillary artery.
The CABG surgery includes preparation, installing lines for the pump, opening the sternum, performing the actual bypass, closing the sternum, and then the ICU. This generally takes a surgeon 3 to 6 hours to perform.
So CABG is performed in one of two ways, either an on-pump or an off-pump procedure, and Mitch will go ahead and explain a little bit more about that for you.
So, CABG on pump. That is the cardiopulmonary bypass machine, which is artificially circulating your blood throughout surgery, requiring your lungs to do nothing. Stopping the heart is required during the surgery as well. They inject you with a potassium solution, and the total procedure time takes between 2 and 4 hours. Spontaneous restart or mild electric shock is applied to the heart after the surgery is complete, and it costs around $55,000.
So the second one is off-pump CABG, also known as beating heart bypass, and this is only used when 1 or 2 of your arteries require bypass. And this is when the heart isn't stopping, and heart-lung bypass machine isn't being used, and instead, part of the heart where grafting is being done is steadied with a mechanical device. And some benefits with that is a smaller incision, lower cost by 25%. That also kind of gives you a decreased hospital stay because it's a smaller incision, makes sense, and decreased blood trauma.
After a CABG, we're going to talk about the recovery. So the patient will be in the ICU for about 1 to 2 days. In the ICU, the patient may have some drains and tubes and an IV line. And because the patient will have their endotracheal tube removed, they may need some oxygen therapy, which includes coughing and breathing techniques. They will also need a progression in consuming fluids and solid foods. And the patient may have muscle pains, fatigue, post-operative depression, and chest pain. The patient may be in the hospital until discharge after 3 to 5 days.
Okay, so some clinical implications for patients after a CABG. The first 4 to 6 weeks is kind of the most important. That's where we're going to focus on definitely their wound care, depending on their incision, how many incisions, and how they need to keep those clean and take care of those. From there, we want to kind of inform them on their sternal precautions. The main thing is don't lift, push, or pull anything between 5 to 10 pounds, and kind of refrain from overhead lifting with both the arms. Also want to go over bed mobility and teach them different ways to get up and out of bed, kind of help them return to their home environment. As far as different treatments and exercises, we want to most definitely start with coughing and breathing exercises, techniques and exercises. Then we want to inform them on their posture, different things that they can do like retract their scap, different shoulder range of motion. They can even do some PNF exercises. And finally, kind of towards the end of the 6 weeks, we want to focus on a walking program. That's going to help them out the most. They should do around 30 minutes to 60 minutes a day if possible. That would be one goal that we would set for them. And then also inform the patient that they are going to be a little sore. They are going to have some pain, and that's normal. They did just have their chest broken open. And just be positive and encouraging for them through this process.
Okay, so just like Kaylee was talking about, we want to help the patient achieve their goals. For example, getting them back to their prior level of function or as close to it as possible. If they're ambulating around their house or around their community, we want to get them back to that level that they were before they had their CABG surgery. So ways that we track their progress throughout their 6 weeks and even after their 6 weeks programs with us is a 6-minute walk test, physical performance test, the medical outcomes study short form 36, or 5-time sit-to-stand are examples of outcome measures that we can use to track the progress of our patients.
They also spontaneously restart your heart. Let me just do it all again. Let me know when you need some.
Okay, you can just keep this thing rolling in the background, right? That gives me 1 minute and 38 seconds. Okay.
Procedure by using a potassium solution.
Good.
Are in general just to improve your overall quality of life.
Good. 。 Cabbage includes. Frick.
Lifestyle, which will reduce your chances of future MI.
Wait.
No.
Improve.
Did you think that we were actually
No.
recording?
No, she's just
Okay.
practicing.
I was getting some bloopers.
Oh, okay. As with any surgery, risks are a part of it.
Beep,
Eggs.
beep,
You can say that the goal improves blood flow.
beep.
That's the money shot.
Wait, what am I saying? Just tell me what I'm saying.
You're saying if conservative treatment fails,
Okay. Then you might need a cabbage.
there you go.
All right. Was that recording?
Heck yeah. Just go.
So, if wait,
Pause this and delete it.
He goes.
Got some bloopers.
Just go. I can cut it.
so if conservative,
Golly. Come on, guys. Stop messing around.
needs a cabbage. Cabbage is a surgery that. Stop, man! No, stop it. Done.
The system rebooted. Did you guys see that?
Oxygen therapy. I don't know what I'm talking about. Ah! Okay, can you start it over? That was just a big block.